my screen also. Okay, so can you all see my screen? Okay, so in this today's class, what we are doing is like two things. The first thing is how to search literature and how to submit paper for some publication part. So any one of you, do you have any written paper with you? I just need the abstract. So that part we can completely do on like hands-on. So if you have like anyone in this class is having some paper or just the abstract, let me know. Then we can have a proper class for that part as well. How to find the suitable journal for the publication part. Now, for the starting part, we are starting with the search literature, how to search literature. That is the most crucial part for systematic review and for the meta-analysis. This part will take around 1 to 3 months for systematic review, even for meta-analysis. So you should know how to search database properly to extract the studies of your own interest. Correct? So as such of now, we are at home, so we don't have access to the Embase or Scopus. So I will try to show the PubMed part with some Boolean terms as well. So I want your attention for this class. So I think we can start now. Okay. Now the first thing what we are learning is the scientific literature. So this is nothing but the principal medium for communication, the results of your scientific research with the scientific community. So if you are doing some kind of research publication or a review article or some original article for your thesis part, so what you are doing, you are just writing the literature and you're making it publish. So we can also read like, okay, so this XYZ person has done this much scientific work. He has proven this thing. He has shown the importance of serum creatinine or any blood parameter for some specific disease. That is what known as scientific literature. Now, we have two type of scientific literatures now. The first thing is what your primary literature, correct? The second thing is what we have is a secondary literature. Now, if you want, you can take the screenshot, but I prefer you just try to focus on my words, whatever we are trying to catch. Okay. Now, in the primary literature, what is actually happening? This is the entire newly done results or the thesis part or the research part, what we have done currently, or with some prospective, with some retrospective data. Correct? Now, many of you are doing your PharmDs, many of you are in MD or MS, correct? So people might be working on your thesis part as well. So what you are doing now in your thesis part, you are collecting data from the patient, doing data collection, writing the analysis part, writing the thesis part. That is what your primary literature. So if you are doing a prospective study or retrospective study, it includes all type of publication afterwards. So if you are publishing a paper in a journal or you are doing some conference paper, that is what your abstract. Fine. So if your people are going for some abstract presentation or paper presentation to some journals, they have some certain rules. That rule is like what? You people should not be having published it somewhere else. That is the major rule what we usually follow for the conference presentation. The next thing what we have is the thesis part. The most like I think you all are doing your thesis part as such of now. The next thing what we are having is the secondary literature. This is what now suppose you are writing a review article. So what you will do, you will collect the data from multiple sources. You might be taking data from some prospective papers. You may be taking data from some RCTs or from some any kind of paper. And you are just doing the condensation of those results, whatever you are finding. And that is how you find the secondary literature. I have an example here of one of my own paper. Now in this part, what we have done, this is a review article. So of course, this is what a secondary literature for sure. Done. So this is how it works actually. Now in this part, what we are doing a review article. So what we have done, we have collected data from the primary literature. Correct. Now this is my table one from my own paper. So this is what all the authors, correct? And this is what their prospective research. Now, this all articles what I used was the case control or the RCT studies, correct? This is all like what a primary literature. And from that studies, I have taken out the data of my own interest. That is what my outcomes, correct? So this is what known as secondary literature. So if you are occupying the details or the information from the primary literature, that is what is known as the secondary literature. I hope till now everything is fine. So do we have any doubt with respect to the primary or secondary literature? Anyone? No doubts? No? Okay, good then. So let's have one quick quiz or some exercise. Suppose this is A, suppose this is B. So if I ask you, you answer me. So A is what? A primary or secondary? A is what? A primary or secondary literature? Answer me. Primary, correct? Correct. Others? Others? Primary, correct? Why it is primary then? Answer me. Why it is primary, not secondary? Answer me. Anyone? Why it is primary? It's the original work. Because of it, because this is the original work. No, A is not primary. No, no, A is not primary. See, don't get confused. This is A and this is B. Now answer me. Correct. A is secondary, B is primary. Okay. Others? Review article is secondary. Correct. What about the first one? So A is what? A is what? A is secondary. What about the B part now? Correct. So if you are dealing with a review article, this is what your secondary literature. Now this is what your original article. So this is what your primary literature. Done everyone? Now to the next part. The next thing what we are having is the peer reviewed or the gray literature. The peer reviewed and the gray literature. Again, please try to focus on my words. If you want, you can take the screenshot as well. Now, suppose you are doing some kind of work which is completely unsupervised. So suppose you wrote information leaflet without any supervision, without any cross-checking, without any expert advice. You wrote the prescription, you wrote the information leaflet, and you have given to your patient for the patient education. Correct? So if any document you are publishing without involving a review part, without cross-checking, without checking by the experts in the field, that is what a gray literature. Correct. What about the peer reviewed part? Suppose you are writing a paper, you will send this paper to your guide. Your guide will check, put some corrections. Then again, you will do that correction work. Then again, you will send paper to your guide back for the cross checking again, the next step. Again, your guide will put some comments on it. Okay, I want to check this part. I want to change this sentence. I want to improve this table. So what you are doing, you are sending your paper to some experts in the field and they are putting comments. So automatically paper quality will like going to increase. That is what your peer reviewed literature. Correct? So difference is very clear. So if your paper is undergoing a proper review process, experts are involved, you're getting a lot of corrections to work on. That is what a peer review. If without any review, without any cross-checking, you are publishing your paper, that is what a gray literature. Correct? Now, do you have any doubts with respect to peer-reviewed or gray literature? Answer me. Do you have any doubts with respect to peer-reviewed or gray literature? Correct? Difference is very clear. Correct? Now, let's take some example. Now, this is one of the screenshot from the journal. I think this is JCEH or maybe some other journal of mine. No issue. Now, in this part, what is happening? We have sent our paper. So whenever we are submitting our paper, we will always click on what submit new manuscript. Done. So once paper is submitted, so automatically you need to submit your entire thing. So title page, your cover page, entire thing. Correct? Now, once entire thing has been done, your paper has been submitted. So automatically it will come to the submission being processed. That means one. Correct? Now it will show with editor. Okay, then afterward it will show under review. all those things will come up. Correct? Now, suppose your reviewers have put some comments to you on which you need to answer or in which you need to work upon. So, afterwards, what is going to happen? It will come to the revision part. Correct? Suppose after the getting some comments, your paper directly got rejected. There is no chance for revision. So automatically, what is going to happen? Your paper will come submission with a decision. That is what a rejected. Correct? Now here what is happening? We got a revision for suppose. So it will come where revision sent back to the author part. Now we need to see the comments. We need to work on the comments. We need to file the again our paper, and we need to make one more article, one more word with the comments and their response as well. Correct? The next step will be what? Revision being processed. So once you have submitted all the correction back to the journal, it will come where revision being processed. Now, if you click on this part, revision being processed, your screen will come like this. Like this. This is my own paper, month of June. It is published now. So what happened? It is like under review. That means even after the correction, paper is going for the under review part, whether the comments what we have made has answered or not. So if you are thinking that after the correction, after the you getting the comments, your paper will get accepted, it is like 50-50 again. The paper might or might not get accepted. Many of my colleague paper have received correction 3 times, 4 times, but it got rejected afterwards. Correct? So you don't depend on this part. It is like 50-50 thing even after getting the corrections. Now here what we got the under review part, and afterward it got accepted for the publication part. So here automatically what is going to happen? Your paper you have sent to the journal part, they have sent your paper to some subject experts or in the field. They have put comments on your paper, you have done the changes, and again paper was submitted. So if paper is undergoing a revision part or the reviewing part or under review to the subject expert or the field expert, that is what your primary literature. Correct? Now, so this is what your peer reviewed literature. Now let's take one more example, that is the Wikipedia. Now this is what? Is this gray or the peer reviewed? Okay, Jyoti Singh, please, sir, repeat. Sabas, please repeat. Okay, so what part specifically? Gray part. Correct. The answer is correct to the present image. Ah, yes. Correct, Vikram. How come gray literature, not peer reviewed literature? How come gray isn't a reliable source? Why it is, Keshav? Not reviewed by experts. Okay. Now, can you all see or appreciate the presence of this option on your screen? Edit option. Correct? Now, if you click on this option, so what is going to happen next? It is start to track your IP address. The next step will be what? It will take your consent for the IP address. Once you have given the consent, this page will be open for editing and you can edit this page. Correct? Now this is what cirrhosis, also known as liver cirrhosis or hepatic cirrhosis, and the end stage liver disease. If I want, I can remove this part as well. No issue. Nobody will going to check it. Correct? So even though what we are doing, we are editing the main paper, we are changing some content, and once we click on submit, it will be online. Correct? It will not underwent a review process, nothing will happen, but automatically your things will get changed. Correct? So this is what a gray literature, not a peer reviewed literature. Now let's take one more example, that is your SlideShare. The most commonly used applications by the UG people. Now, this is what? Peer reviewed or the gray literature? Tell me. It's a gray literature. IP address is your own thing. Your entire information will come up with that IP address. Okay. Again, it is what? A gray literature. Correct? It is what? A gray. Why it is gray? because you need to create your ID password on SlideShare. You go there, upload your PPTs, nobody is going to check. It will be there for lifeline. Correct? So this is what a grade literature, not the peer reviewed literature. Done. Now let's take one more thing. Then afterwards we can go to our desktops. So I request you all, if you have time, please start this class in your mobile and be ready with your laptops for the hands-on training for the database searching. Correct. Now, this is what. Now, here we are dealing with the PICOs. Some people follow PICO, but I follow PICOs. So, what is PICOs now? So, P stand for patient or your population of the study, whatever you are taking. Then we are having I, that is what the intervention, what intervention you are actually doing to your patient. Correct. The next thing what we are having is the control group or the comparison group. It can be a drug, it can be a placebo, it can be anything. Correct? But we have PICO. So P is what population, I is what your intervention, your new thing, whatever you are doing. C, that is what your comparison group or your control group. Then we have O, that is what outcomes. Then we have S, that is what study design. What type of study you are taking? Is it randomized control trial? Is this case control? Is this a review article, case report, case series, all kind of articles? So if you are planning a review article or any kind of article, especially if you are working for systematic reviews or meta-analysis, you need to work first on what PICOs. Correct? Now, P is what again a problem or your population. I is what intervention. C is what your compare or control group. O is what your outcome. S is what your study design. So let's take one example and afterward we have one more question for you. Now suppose, let's take, we are taking a liver cirrhosis patient. Suppose we are taking a liver cirrhosis patient, correct, for my study. Now I want to check the role of carvedilol and propanolol, correct, in the liver cirrhosis patients with portal hypertension. I want to check the role of both the drugs. Now I want to check which drug is more good with respect to the serious adverse event or the adverse events, or which drug is more powerful to reduce the portal hypertension, which drug is more useful to decrease the other complications like ascites, like SBP, mortality, and which drug is more useful to increase the patient HRQOL, that is the quality of life. Correct? Now, this is my objective in my mind, but I need to write somewhere. Correct? Now, I need to frame the PICO. Now, what we are doing, we are framing the PICOs now. Now, even if you have ever seen my papers, what I have published, I always try to focus on two main things. That is what a randomized control trials and the case control studies. Correct? If you want, you can do a systematic or meta with any kind of paper. But I always focus on RCTs and the case control. That's it. Because this will improve, this will give some advantage to my paper. So even though if I'm publishing a simple review article, I will try to include case control or the randomized control trials. I will not include the review articles or case report or case series. If I'm getting the option, then of course I will try to add the systematic or meta in my review article. Okay. Now, in this part, let's start with the P part. That is what your patient. So my patient is what now? Everything is there on the screen. So I need answer from you. So here P is what? Liver cirrhosis patient. Correct. It's not the pulmo hypertension, Hiba. It's portal hypertension. It's not pulmo. It's portal. So like you all are correct now. We are dealing here with what? A liver cirrhosis patient. Correct. What about I? Now suppose in this condition I want to check because in the starting phase we used to use a lot of propranolol, but nowadays our practice is shifting to the carvedilol. Correct. So here suppose I want to check the carvedilol with the propranolol now. So my I will be what? My I will be what? My I will be what? Drugs. Which drug? Correct. Carvedilol. Correct. What about my comparison? What about my control group? What about my control group now? Propranolol. Correct. Okay. What about my outcomes now? Tell me what outcomes I'm actually looking for now. Answer me. Correct. Now decrease ascites, decreased SBP, decreased mortality, increased HRQOL, and all. Correct. Good, everyone. Good. What about the studies? As it's me, so I always focus on the case control. I always focus on the randomized control trial. So I will take only this two type of paper. That's it for me. Correct. Now this is what how we frame the PCOS part. Now let's take one exercise for you people now. Now, here is the question. To access the change in HbA1c, ppbs, rbs, FEBS, and HOMA-HR with metformin and voglibose in patient with diabetic mellitus. Now, let's frame PICO. PICOS. Correct? Now, you answer me. What is the P here? Answer me. What is the P? Correct. Diabetic mellitus patient. What about the I? What about the I? What about the intervention? Metformin. Correct. What about the control group? Voglibos, correct. What about the outcomes? What about the outcomes now? What about the outcomes? Please be quick. Change in what? Parameters. Parameters like what? In the question only we are having HbA1c, ppbs, rbs, fbs, HOMA-HR. Correct. So my outcome will be what? To access the change in what? HbA1c, my rbs, fbs, ppbs, and HOMA-HR. Correct. Now again, we need to improve our study outcomes. So always take what a case control or the randomized control trial studies. So this is how you need to frame the PICO. So if you know how we are framing the PICO, then our things are very, very simple. Apart from this part, I need to discuss more important things now. Three Boolean terms what we usually use, that is what and okay, sir, how to know that metformin is the intervention control is the overdose? Okay, now the other thing is, suppose it will be in your mind always, like what you really want to check and what to compare in that part. So if you are doing a study, suppose I want to check my blood pressure patient. So I want to check if my blood pressure patient in the practice, what we usually use is the telmisartan, that is Telma, correct? Now, Telma is much better. Sorry, just a minute. Yes. Okay, so Telma we usually use. Now I want to check whether Telma is okay or not, or much superior or much inferior to the Telma or plus some diuretic. Correct. Now Telma is what that we usually use. Correct. Telma plus diuretic is what that I want to check for my patients. So this will be what my intervention. This will be what my control group. If any drug, anything you want to check whether this can improve or not, that will be your intervention. Correct? Pico start once. Yes, here is the Pico. Okay, now suppose let's take one more example. I want to check whether patient education can improve or not patient disease knowledge. Correct? So what I will do, I will make two things out of it. One patient group will getting the patient education, other will not get the patient education. The other group automatically will go to doctor and doctor will tell all the things like this is how it works. Correct? In the intervention group, we are giving some patient education. So your education is what? Your intervention. That is what you want to check. Whether my intervention is improving or uh, like decreasing the patient knowledge. This is what I want to check, correct? So my education will be what? The intervention part. Correct? I hope this part is clear now. Clear? Others? Okay. Now I think we can close this class and we can have a proper hands-on practice now. Okay. So for the hands-on practice, I want all of you to use your laptop and try to practice with me. Okay. So let me share my screen. You please let me know if you can see my screen. Okay, let me open the chat box. Okay, visible, visible, visible. Okay, please repeat what? Saba, which part? The pig course. Don't worry, we will learn about this part in PubMed. No issue. Now the first thing what we are doing is like we will open our PubMed. So everyone, okay, please open your PubMed. Only PubMed. Okay. Now this link I am sharing with you all in the chat box option to make it quick. I just have shared. Please check. Done everyone? So please be quick now if you want to learn the proper database searching. So open this link in your laptop and you can practice with me. Everyone all done? Yes? Okay. Now the next step is what? Click on the advanced part. Click on the advanced. Now this is what you're getting now. Okay, so let me remove this part. Confirm. Okay. Now again, I will share this link with you to make it quick. So if you're like not on the PubMed, click on the new link what I have just provided. Now this is what we are starting with the advanced database searching. So if you know this thing, then our work is very much clear. Okay, I think I have forgot to tell about the Boolean terms that what we were like discussing before. Now remember we have three terms, that is what and, or, not, correct? And how to write this part? All in capital. Either and, or, and we have not, correct? So how and work? And work, suppose in this class I will take some names, so please like don't be get offended for this part. Okay, so I am telling in this class I want, suppose we have Pushpa and Meghna. So if I'm telling I want Pushpa and Meghna, that means this and represent I want both of them in my class, correct? So what I'm telling now, in this class I want Pushpa and Meghna. That means whatever studies I'm getting, I want these two names in my title for sure. Correct? What about the or part now? So if I'm telling in this class, I want Meghna or Pushpa, that means I'm happily acceptable, accepting both of you in my class. Either I want Meghna or I want Pushpa. That's it. This is my simple terms. Correct? The next thing what we are having is not. Correct? Now suppose, okay, one more name we got, Tanmay. Okay. Now suppose in this class I am telling uh, Meghna, not Tanmay. Correct. So what is going to happen? I want Meghna but not Tanmay in my class. Correct. So this is how it will work. So for the broad search, always try to focus on the or, not on and not. Sorry. Yes. So let's start with some database searching. Now suppose we can take our previous example only about the liver cirrhosis, but you should know the key terms what we usually use for our own practice as well. Okay. Now suppose I want to check all the liver cirrhosis patients and the beta blockers what we were discussing in our writing part. Okay. Now liver cirrhosis is like what? A liver cirrhosis. Some people use cirrhosis only. So we use or. Don't use and, use or, because the initial search should be very broad search, not the limited search. So always use or will give you the broad search terms. Or we can use cirrhosis. Some people we follow decompensated cirrhosis. Some people follow compensated cirrhosis. Correct. Now click on add. Now click on this down arrow, click on add to history. That means I am getting around how many studies? Around 4,43,000 studies with the term either liver cirrhosis or any other term, whatever I am giving. Now suppose, let me take one more example now. I will take the same terms and I will replace or with and. So automatically what will happen? The number of articles will decrease. And let's, okay, all replace, no? Okay, okay, all replace. And click on OK, add to history. Now see, if you notice the numbers, it is how much now? Around 1016, sorry, 600. But with the use of or, we were getting how much? 4 lakh studies. That is a big, huge difference, correct? That is why I always use or, not and or ought. Now, the next objective was what? To compare with some drugs. That is what beta blockers. So both drugs are like about a beta blocker only. Okay. So if you know the class, both are what? A non-selective beta blocker. People can write non-selective beta blocker as well. Okay. Then what about the drug name? It is propranolol. And the other drug what we were having is the carvedilol. Okay. Carvedilol. Okay. Or that's it, I think. Now click on add to history. Now see the number of articles what we are getting with the term beta blocker, NSSB, propranolol or carvedilol. If you want, you can add NSBB also in the key terms. Now our next step will be what? We need to combine both the terms whatever we have searched. Now in the search part, I hope you can appreciate #1, #2, #3. Correct? Yes or no? Yes or no? Yes or no, everyone? I hope you all can appreciate the presence of #1, #2, #3. Correct? Now, this second hashtag we can ignore because this is just for the trial purpose we were doing. Now, I want to combine that my key terms, whatever I have searched. So what I will do, I will write #1, use your and Boolean terms, then again #3. So in this part, I am telling my permit, I want to combine the search terms, whatever we have used for the permit for the liver cirrhosis part and for the drug part. Okay. Now combine this two part, then click on add to history. Now we got some number of articles in which titles will be containing either liver cirrhosis, beta blocker, propranolol or carvedilol. So our next step will be what? Click on this number, what we got in the end. Correct. So this is what the number of articles, whatever you are getting. Now let me share one more thing with you that is more important as such of now. So let me open my Word file. Okay. Now, if your people are planning for the systematic review or meta-analysis, you people need to submit the database searching, whatever you are performing. Correct? So how to do this part? You need to perform the search part for PubMed, Embase, and Scopus. Hashtag part. Okay. Okay. Now, this is what we are getting. Just give me a minute. One important call. Just give me a minute. Yes, sorry. Now you want to ask for the hashtag part. Okay, done, done. Now the hashtag part is what? This hashtag will represent the entire code, whatever we are getting here for the liver cirrhosis part, like what terms, what we have used for the liver cirrhosis part. #3 is what? It is representing the drug part, beta blocker. carvedilol, propranolol, NSBB. Correct? Now, what I want PubMed to combine both of my hashtag part to combine because in the end we want all things together. Correct? That is why I'm using what? Hashtag 1 and hashtag 3. That means I'm telling PubMed to combine the key terms, whatever we have searched for the liver cirrhosis part and for the beta blocker part. Correct? Now, once this part is done, so automatically you will get the number of articles that is having the title name or in title all the terms, either beta blocker or propranolol or carvedilol or any other key terms, whatever we have given. Now, with this key terms, whatever we have searched, we got around how many articles? 2, 2, 3, 6 articles for the filtering part. Correct? Now, okay. So in this way, we know the idea. Okay, just give me a minute. We are coming there only. But before it, we need to discuss one more important thing, that is what the database searching part, correct? So if you are planning for systematic review or for meta-analysis, you need to submit a supplementary file in which you need to mention all the codes, whatever you have used for database searching. Now you need to make separate tables for PubMed, for Scopus, and for Ambase. Now suppose we are making for the PubMed as such of now. So what we will do, you put your serial number, then you put your database, your search codes, and the number of studies, whatever you have got. This is why we are doing, because it's a long process. Database searching will take time, paper writing will take time, paper submission will take time. So in that duration, what is going to happen? Automatically, the number of articles will increase afterwards. Correct? Now, suppose in this class, you people are planning a paper to do, a systematic review. You did the database searching, you did the entire thing. So during your database searching, you got around 1,000 articles. So if I search this with the same key terms, I might found extra 50 articles after few months. Why this is? This is why, because people are publishing article on daily basis. So this is what journal want to check, how many articles you got during your database searching. So this is what you need to do. So 1, 2, and 3. So my codes. So what we are going to do, the first part is what? My liver cirrhosis. So copy from this part to this end, copy, and again put for this code part. Correct? Okay. Let me change some settings. Okay. Now look at the number of articles what we got with the hashtag 1. That is how much? 443745. Correct? How much? 443745. Correct. Now we want second codes, whatever we have run. Now back to our main PubMed. This is my second thing about the drugs part. So select from this part to this part. Now copy. Correct. Now put here. And the number of articles what we got, it was around, I think, 109971, if I'm not wrong. Okay, then third part is what? The number of articles what we have combined. That is what your end part, that is hashtag 1 and hashtag 3. Now click on this part. Now copy the entire thing. This is the entire codes what we got. Just up to the before transition, after this part. Correct? Now this part will come here. Now again, report the number of articles, whatever you got. This is how much? 2236. How much? 2236. Now this is the table what you need to report to the publication part as well as the supplementary file. This is only for the permit. You need to follow for the Scopus and the Ambase also. Then everyone, so this is the very crucial step. Don't forget this step. You need to submit this file, otherwise paper will not get accepted. Correct? Now back to a PubMed part. Now suppose I want to check this part because I need to screen my data now. So how systematic review and meta works? First thing is what? Database searching. Correct? Afterwards, we need to filter the study as per our PICO. The next step is what? We need to read the entire abstract. If it is matching with our outcomes, then take the entire paper, read the entire paper, extract the information out of the paper. Done? The next step is what? Data entry for the Excel part. Correct? So our first step is what? Database, that is completely fine. Now I need, suppose what happens for the publication part. So whenever you are working on the articles for systematic review for the meta-analysis, always try to work on the last 10 years. That's it. Because database searching will give you the papers from a long time back. Here we can see it is like what? 1967. To which date? Till today we are getting all the number of papers. Okay. Sir, where to paste this in paper? Okay, so during the paper submission to some journals, there will be one option that is a supplementary file. In that part, you need to submit that file as supplementary file. Correct, Reshma? Done, Reshma? Okay, done. Now, suppose I really want to work on my systematic review and I just want to focus on the randomized control trial. So on the left-hand side, I have entire things. Correct? Now I want to work on what? All randomized control trial. Correct. Now click on randomized control trial. Correct. Now I want publication from the last 10 years. That's it. I want to take publication from the last 10 years. Click on 10 years. Correct. Now see, automatically the number of articles from 2000s come to what? 54 articles. Okay. One more question. Is it applied to all journals? Yes. If you are working on systematic review or meta, you need to submit your database searching also. It is common for all the journals. Systematic review or meta-analysis, you need to submit your database searching. And this is for sure. Then everyone, now the question comes, now here, all the 54 articles what we got are all randomized control trial revolving around your own key terms, whatever we have given. Now the next thing comes, how to import this data only for review. See, review is different, systematic is different, meta is different. Correct. So for the normal review article, there's no need to report the database searching. So if you are doing a systematic review or meta, so for that part, you need to report a database searching for sure, but not for the simple review article. Done? What about research? See, PICOs you need to frame for entire things for like whatever you are doing. But database searching, you know, like no need to submit to the journal if it is not meta or systematic review. Uh, I think you are shooting some umbrella terms in the chat box. Review, what review? Systematic review, a simple review, or a meta-analysis. What about research? What research you are talking about? It's a prospective research or retrospective research. It depends. But for the research also, database searching, of course, need to perform, but not to report here and there. But database searching codes, whatever we are giving, we need to report for our journal part if you are working on systematic and the meta-analysis. Shirin, if you want, you can report last 5 years also. But last 5 years, that means less number of studies, whatever you are focusing. So what happens with the systematic or meta-analysis? It's completely your choice. If you want, you can take last 2 years, last 5 years, last 10 years, or last 50 years. Completely your choice. But what we usually do is last 10 years. This is why, because we don't want to put a long back data. That is old data. In the last 10 years, multiple things have changed from the previous 10 years. Correct? So that is what we need to report with this part. So always try to focus on the fresh results, whatever you are getting for the fresh research. Okay, so difference between review and systematic review. Okay, so review is what? A simple review. Okay, so let me open my own paper if I can show you. Okay, just give me a minute. Okay, so this is one of my paper. It is in Scopus journal. Okay, we need the access. Okay, so review article, how review article works is like this is the overall summary of the information. Review article is like a book chapter that we can only read but we can't practice. Correct? In the systematic review, wait, I have my own publication. I can show you my systematic review. Uh, Correct. Okay. So here is my paper, a systematic review. In this part, what we are actually doing, we are putting the statements. Systematic review and meta can actually change the practice. Correct? So what happens in the review article? It's like a book. You will write the entire things. Okay, this is also good. This is also bad. This is also better. This is also worst. Okay. For the systematic review, you are actually putting a statement. Now, in this paper, what I have done, I was checking the role of GCSF for the treatment of liver cirrhosis patients, a systematic review. Now, in this part, what we have reported, okay, this much study is what we have got, and multiple cycles of GCSF significantly improved the survival rate, disease severity score, 34 cells count, HRQL also, and significantly reduced the incidence of liver transplantation, ascites, infection, and hepatic encephalopathy. Correct? With this statement, I can actually change the current practice. I hope you are catching the difference between systematic and the simple review article. So simple review article is what? A brief summary of the entire research, whatever you are getting. Correct? What about systematic review? You are actually making a statements. Okay, we can do this part to change our practice. Do this thing to change patient outcomes. That is what things are changing. So I hope this part is clear. I think Jyoti and Vikram also. Done everyone? Okay. How to publish a review paper in the Scopus journal. Okay, the thing is, Ramsha, your paper should be having some unique things in for the publication part. Correct? So suppose you are writing a paper and you have given for some publication part because Scopus will not settle down in the less quality paper. Correct? Now suppose you wrote the paper, I think it was Ramsha, yes, on the same topic. Correct. So what will happen afterwards? You will get the comment from the journal. Okay, so we found a paper with respect to the same outcomes, whatever you are doing. You answer us whatever new things you are doing for this paper. If your paper lacks the novelty or some new information or some new research, then that paper will never get published into the Scopus Index journal. Scopus journals will completely focus on the novelty, the good quality of research. That is the one thing. So if you think your paper has some novelty, then you can blindly go for Scopus journals. Okay, meta-analysis. Okay, wait, I will show you my own paper again. It is not published yet, but I can show you. No issue. Give me 2 minutes. Where is my meta-analysis? Okay. Okay, so I hope you can see my screen now. This is what Prisma guidelines, what we usually follow. The same thing what we have done for the PubMed search, we have done same for here as well for this paper. Now this is what a risk of bias graph what we need to report for the meta-analysis. Now remember the quality wise, meta, then systematic, then the RCT. So meta is the top class of research. Whatever you are doing, meta is the top class of research. Okay. Now in this part, what we actually doing is like, I'm reporting like which drug is comparatively much better. Now I hope you can see this graph on the screen. It is what favors propranolol, favors carvedilol in this graph, correct? Now this small diamond is coming to which direction? That is what favors carvedilol. That means I can conclude, yes, hepatic venous pressure gradient can be improved with the help of carvedilol, but not with the help of propranolol, correct? So this is how meta will come up. Done everyone? So for the meta, you should be having a good knowledge of statistics part also, and the knowledge of mean deviation, standard deviation, mean, and the use of application as well. So meta is like you are actually putting the statements, don't use propranolol, use this drug for the management because the practicing part also depends on the meta-analysis, correct? So with this paper, we can actually change the guidelines, we can actually change the practice as well. So with this paper, I am reporting, okay, don't use propranolol, use carvedilol. That is much better for patient with liver cirrhosis. So it is showing also improvement, correct? Same thing we are getting for the B part. That is what a wedge hepatic venous pressure. The same thing we have done for the secondary outcome. That is what heart rate, cardiac outputs. or mean pulmonary artery pressure, arterial pressure. Then we have done the same thing for what a tertiary outcome. That is what hematemesis, orthostatic hypotension, breathlessness, dizziness, hepatic encephalopathy. Correct. The next thing, that's it. So this is what we do. Yes, we have a Raveman. So if you have a working knowledge of Jamovi, SPSS, Raveman, you can perform Meta as well. No issue. See, systematic review can be done without the meta-analysis, but for the meta, you need systematic review. That is a major difference, Saba. I hope I answered your question, Nancy and Saba. Correct? Okay. Now again, we can go back to our search part, this part. Saba, you can perform meta for any kind of studies. There is no limitation, but your paper should be strong because nowadays research rules are getting very strict. So you should be focusing majorly on the latest articles. So please try to focus on case control or the randomized control trials. Simple. Okay, now back to our main PubMed search part. Now in this part, what we are doing, we need this all 54 studies for the filtering process. Now our first step is done. That is what database searching. The next step is what we need to search for these titles. Okay, this title is matching with my PICO or not. If it is, then read the abstract part. So what we're going to do, go and click on save, correct? Just click on save. Now, this part, click on all result, not on this page. Click on all result. Now click on CSV. CSV is what? Nothing but the Excel sheet. Now click on create file. So automatically it get downloaded. Now open that part. Okay, it's opening. Okay, so this is how it comes like for the PubMed part. Now the problem with this thing is like we are not getting the abstract. We are having PMID, we are having title, authors, citation, first author, journal book, publication year, then date, all things we are getting, but we are not getting the abstract part. That is the most important part as such. So what we do usually, we use Zotero. So open your Zotero. If not, then please just watch what I'm doing now. Okay. So how to import all the database searching to our Zotero. So how to do? Click on send to. Simple steps. Click on send to. Now click on citation manager. Now again click on all result, then create file. Okay, it got into my laptop now. So what I will do, I will open my Zotero. I will click on file. I will click on import. Click on file. Open the Zotero. Click on file. Click on import. Like this. Now click on next. Now this is the file what we are looking for. Permit 1 and 3. Click on open. Then click on next. Now it is importing. All 54 items has been imported. Finish. Now what I will do next step is like I need to transfer the entire database searching into the Excel part so we can all work together, correct? So what I will do, click on file, correct? Click on export library. Okay, we can do here also. Now click on this part, then right click, then click on export collection. CSV only we want. CSV is nothing but the Excel only. Done. Then click on OK. Now okay, we can submit here also. Class use. Done. Now, okay, let me save on desktop. Okay. Now let me open the file. Permit 1 and 3. Okay. Just give me a minute. Okay. Now this is the sheet what we got from the Zotero with all 54 number articles what we have obtained from the database search. Now the most important thing we will keep. Others we can remove. Remove key, item type, publication. Okay, we can keep. Authors don't want publication. We don't want ISBN. This part, URL, date, other things we don't want. Correct. Now this all things you can remove for sure. We just need to focus on what titles and the abstract part. Other things we can remove. We don't need other things like this. Okay. Now, what will happen? Our next step is what? Read the title. Which title is matching with your Pico? Now, suppose the title number one is matching with my Pico. So, what I will do, I will mark it green or completely up to you. Okay, this is fine to go. Okay, number two article. Okay, it is not matching with my Pico. For example, I will just mark it red. Okay, this we need to ignore. Okay, this third is matching with my Pico. Okay, 4, 5, 6, 7, 8, all are matching with my Pico. And suppose this number of articles are not matching with my Pico, so I will mark it red. The next step will be what? All the articles in the green color will be go for the abstract screening. That step is what? You come to the abstract part. Come to the abstract part. Okay, this is green. So the next step will be what? Read the entire abstract. Whether the result part is matching with your outcome, yes or no. If it is matching, the next step will be what? Mark it green. Correct? Okay, this is red. Completely ignore. Then again, we are having the green title part. Now read the abstract. Okay, it is not matching with my Pico part, so mark it red. Correct? Now, out of 54, hardly you will get around 5, 6 articles in the end. So this database searching, database screening, title and abstract screening will take a pretty much long time because for some number of articles, for some number of studies, we got around 6,000 as articles. We got around 10,000 articles from a single database. So that is what it takes time. Correct. Now suppose out of this group, this part got selected for the paper screening. So our next step will be what? This green abstract. Then the next step will be what? The read the entire paper. Correct. And try to extract all the information as per your PICO and do the database entry. Correct. So once done, then we can perform the meta-analysis. So here, if you can see, we are getting this Bine K day, mean plus minus SD is how much? 86.2, 13.29. This number we got from where? From this article only we got. That is what a data extraction look like. Correct? Now this is how you perform data extraction, database searching. Now, if you understood how to database search for PubMed, then automatically you can perform very well for Ambase and Scopus also. You just need to focus on what and or not. Done, everyone? So do you have any doubts, any questions now? Anyone? Zotero is the reference management software in which you can manage your references for publication part. Nancy, it will take a pretty much long time. Quick recap from the PubMed till the abstract getting phase. It's a very long process. It's not the simple thing. Okay, so quite clear, no? Okay, done. Of course, you need to practice simple things. Yes. Of course, Tatanmay, recordings we will share for sure. Okay, the next thing is what? The next thing is very important. That is the journal searching for the publication part. So, okay, so my question is, do you have any abstract in your hand now? Anyone? Anyone? Do you have any abstract in your hand? Or anyone looking for some potential journal for the publication? Do you have or not? Anyone? Others? Okay, iMac 2 is having. Okay, so what we can do is like iMac, you can share your screen now and I can guide you with the journal search, how to find the appropriate journal for the publication. Is it fine? Or if you want, you can share your abstract with us also. So we can have the proper hands-on as well. Completely up to you. Just share your abstract in the chat box option. So then I will show you how to perform anything. Uh, Database searching is very important also for any type of paper, whatever you are performing. It's not limited to some specific articles or research type. You should do a database searching properly once. But we don't practice all this thing. We usually practice this thing for systematic or meta-analysis. iMac, I think you can WhatsApp me. No issue. Directly WhatsApp me on my personal. Let me open my WhatsApp also. I don't have your number. Okay, I think somebody has sent. This is in review article. Okay, so I got one abstract. Okay, okay, fine. Thank you so much for sharing your abstract. Okay, so I will take this abstract now. Now, how to search the potential part is like what? So open the Google Chrome. You will write journal finder. Okay, or just remove the Springer. We don't want Springer. We want Scopus. So remove all this part. Click on find a journal. Okay, so this is what we are getting, right? Now here we need to enter our abstract. Just copy paste the abstract, whatever you have wrote for the paper. So what we are doing, I'm just copying pasting the abstract what I got. So you just copy paste here. Done. Now click on find the journals. Correct. Now here we are getting two options. That is what the open access and the subscription part. So what is the open access journals? It is like you need to pay some amount of money for the publication part. So suppose your paper got accepted, but you need to pay the money after the acceptance to make it as an open access. Correct? What about the subscription part? Only abstract will be available for the publication part. So the readers need to pay, or if your place is having the subscription with that part, then automatically you will get the article with your internet service and all those things. Suppose in this part, here what we are having, no publication charges. It is open access. Correct. Now in this journal, what we got first, it is having both the options, first open and the subscription part. So completely up to you with the database, sorry, paper submission part. It will ask, do you want to go with subscription or the open access? So if you select open access, so what is going to happen? You need to pay the money after the publication part. Now, here we are getting the potential list of journals that are suitable for your paper publication. Correct? Now, but we can't select the entire thing. So what I will do, I will select some certain journals. Okay. So with respect to your abstract, I'm getting this much options. So suppose I'm opening this part. Okay, I got this thing. Now, review time around 225 days. This is a very long time. So I will never choose this journal first of all. If it is getting accepted, I need to pay how much for the open access? This much amount. In lakhs, I need to pay. That's why we always go with the subscription part, not with the open access part. Some colleges do have some collaboration with the Elsevier, so we do no need to pay for the publication part or for the open access. Automatically, your place will take care for it. Done. But always do cross check with your place or the place you are working, whether they have or not. Done. Now let's check other journal also for the example. Okay, let's check this part. Okay, so this much I need to pay if I'm going for the open access. How much rate will take? So remember, this day should be always less. So lesser the day, more rapidly you will get the response because we are not sure what is going to happen afterwards with my paper. Correct? It might get published, might get rejected. So for the rejection, if they are taking around 3-4 months, then it's completely useless journal in that part. Okay. So always try to focus on the journals which take less amount of time for the first decision. So I hope this part is clear now. Everyone, any doubts? Okay, let me open the chat box also. After opening the Chrome on WhatsApp and Scopus journal, it would be highly okay. Done. No, this part is done. Okay, so what I will do, I will share this link with you all in the group. This part. Hmm. So you go this to this link, open this link, and directly copy paste your abstract, whatever you have got. Just a minute. Ah, yes, sorry. So what you will do now, just copy paste your abstract for the here and click on find journals. You will get some potential list of journals. Okay, my mistake. Yes. Let me send to the entire group. Wait. Yes. Of course, you can publish. Usha, see, every journal is giving you two options. Not everyone, but journals will give you two options. Either you can go with the subscription part or go with the open access. Multiple journals are having both the options, correct? So directly go with the subscription part. So let me show you my own paper only, for the example part. Now let me open my paper. I will show you. Okay, this is what we have done. Okay, now this part you see. Okay, but this is my, like, it is like automatic going to open. So I need to find something that is not open. Now see, this paper I have submitted through the subscription part. So with this part, I can only read the abstract, that's it, correct? But if I am using some internet services or I have some subscription part of this journal, so automatically I can read the entire journal. Okay. Okay. Only show the else with the journal. See, Nancy, that was the question. Because we are directly searching for the scopus, if you want, you can search for the Springer also. Remove this else here and put the Springer. So automatically you will get the options for Springer part. Okay. So for beginner, sorry, I'm not able to read the money so much. The less money for open access. Krishna, no need to go for the open access first of all. If you have the option to go for subscription, you blindly go for subscription part. There is no issue. Scope personal. Good question, Vikram. Okay. So let me answer one more question. Okay. So I will show you one of my paper. Uh, okay. I think it was a systematic review. Yes. Okay. Now this journal, no, this journal is the subscription journal. Sorry, this is the open access journal. Correct? This paper, what we have submitted this journal, no, this is the open access journal. So we need to pay money for the publication part as the open. But luckily, what happened? I got the invitation from this journal to write the systematic review on this topic. So if you are getting the invitation from the Scopus Index journals, then automatically there is no payment fees. So if you want, you go and search. This journal is what the open access journal. So you need to pay the money for the publication. Correct? Once get accepted, that then only. So I got the invitation. I wrote the paper. I have given the paper, and without paying any a single penny, my paper got published open access. Of course, even though you are getting the invitation, it does not mean that review will not happen. So this paper underwent a review two times and then got published without a single penny. Why? Because I got the invitation. That is what play a secondary role for the publication part also. How can we get the invitation? You will not get the invitation like a random invitation. So you need to prove yourself in that field. So if you are good in your field, so automatically people will contact you for some kind of papers. So I belong to the hepatology part. I did some good work, so automatically I got the invitation for my paper. Even for that meta-analysis, what I have showed you, I got the invitation to publish it. Again, it's a Scopus Index Q1 journal who have requested me to publish this paper. So you need to prove yourself in your field, then only you will get the publication request or the invitation. But one more thing is there that If you publish a single paper, so multiple journals that is not Scopus index, which are predictory journals, will start to keep you emailing. Dear eminent author Anish or Nancy, please submit your paper to our journal for this thing. Something big, big words they will write. So for that part, no need to submit your papers. You should be able to check, okay, I am getting this invitation, whether this invitation is valid or not. So how to check that part? I will show you. So what we need to do is like you go to the Scopus indexed, write this part, Scopus indexed. Now list of Scopus journal. Okay, so I will again share this link in the group to all of you. Okay, now this is all the Scopus index journal list is here. Now I want to check with title only. Okay, now suppose I publish my paper. Suppose this paper, where it went. Okay, let's take this paper. That is what a novel drug. So this paper I have sent to the JCEH. Okay, so let me search whether this journal is okay or not to go. So full form is what? Journal of Clinical and Experimental Hepatology. Experimental JCEH, correct. Now click on this part, find sources. See, automatically name came up while the searching part. This thing, correct? It is showing 60%. That means what? It is Q2 indexed. If it is up to 25, Q4. Up to 50, it is Q3. Up to 75, Q2. More than 75, it is Q1. So it is what? 60 here, that is what? It is Q2 journal. And it is Scopus indexed. During the searching part, if the name is not coming in the result, that means that journal is not a Scopus indexed. I hope that question is clear now. Vikram, yes, others? Do we have any doubts now or any questions? Anyone? No doubts? Clear, right? Not all, Saba. You need to search journals who are giving you both the options, subscription and the open access. If you have money around 4 lakh, 5 lakh, 10 lakh, you go blindly with the open access, no doubts. But if you are publishing with the subscription part, that is also fine, no issue. I just showed no this part. This part I just showed no Q1, Q2, Q3, Q4. Okay, I will share this link with you all in the group again. Here is the link. You can search here. Done, everyone? Okay, so do we have any doubts, any questions now? I'm happy to answer. In the meantime, I am sharing, specify the quality. Yes, Q1, top class, Q2, Q3, Q4. It's rank wise, Q1, Q2, Q3, Q4. Always try for Q1, Q2. If not, then try for Q3, Q4. No, no, Saba, no. Both are same. No difference. Okay, so I'm sharing this attendance form as well. So please fill this form. I am sharing now. Everyone, please fill this form as the attendance form. Okay, so in the meantime, do we have any questions or doubts? I'm happy to answer. Anyone? Any questions? Any doubts? Anyone? No doubts? Okay. If the status assigned to editor, that means a paper is with the editor. Afterward, it will go to the under review process. Sometimes what happen, you will submit the paper, it will show paper submitted. Then it will show with editor or something word they will use, but it says editor only. Now editor will see, okay, this paper is fine to go or not. If it is fine, then automatically paper will be when go for the review process. So multiple experts will get the mail. Do you want to review this paper? If they say yes, your automatically status will change to under review. Then depends on the reviewer. Usually nowadays, they are asking us for 2 weeks only. So within 14 days, we need to submit our review or our comments. Once done, you will get the comments. If your paper is getting rejected, two things can be there. The first thing is what? With the editor afterwards. Editor feel this paper has no novelty, paper has not matching the guidelines, reject the paper. Done. Reviewers think, no, this paper has no value, nothing is good, paper is going here and there, lot of things to be changed, paper rejected. Only if you are getting a minor corrections or not that much major, then you will get the revision. Otherwise, rejection. Search about thesis? No. No. See, this is not how research works. No. Okay, this question is done. Thank you. Okay. Websites to search about thesis? No. You need to plan your thesis on your own. Saba, of course you can message me. There is no hesitation. Please do message me. I will help. No, it's not the correct thing, Saba. See, standard journals, Scopus, Springer will never message you first of all. If you're not that much well established in your field, they will never call, they will never mail you also. You don't even exist for such people also. So you need to prove yourself in your field, then you can expect the invitation mail from the journals, which are Scopus or which are properly indexed. Again, Tejamal, it depends on the quality of paper. See, suggesting the good journal name will not get a paper published. Your paper should be good for the publication part. Supplementary is like Soumya, it is like the extra things to remove the bias, to remove the questions in our mind, to remove the wrong things. We ask for data in supplementary file. That is why we need to submit database searching also. Number you want? Okay, I will message in the group. Don't worry. This is my number. You can contact me, okay? Done, everyone?